40,000 people. That's how many Britons the Financial Times estimates have died during this pandemic. It's more than double the government's own figure of less than 20,000, and many of them have died in care homes.
I don't have the precise figure for care homes.
The elderly, the most vulnerable people living in the UK, are being killed by the coronavirus, and the government won't tell us how many of them are dead.
We're not really getting a decent picture of what's happening in the community.
In France, the figure is reported daily. In the UK, there's a 2-week lag for data from the Office for National Statistics.
It's absolutely awful, and we don't get time to grieve because by the time we finish with one person, we have to move on to the next.
We have had 12 deaths from COVID-19.
The latest death toll released by the ONS is 41% higher than the daily figure given by the government at the time. In the space of a week, the number of coronavirus-related deaths in care homes has quadrupled, from 217 to 1,043. Using this information, the Financial Times estimates that as of April 21st, the actual coronavirus death toll is 41,000. The government's own figure as of that date is 17,337. It's more than double. Some have accused Downing Street of a coronavirus disinformation campaign. We've spoken to experts, including those at the highest level of decision-making and carers, to show the grim state of affairs in British social care. John Ashton is the former Regional Director for Public Health in the northwest of England. He said the UK's approach to reporting coronavirus deaths is misleading.
I think one of the growing concerns this week is about what's going on in our care homes. We see in the daily press conferences a focus very much on what's going on in the hospitals and the deaths in the hospitals. And we're also being told that the numbers of admissions to hospitals has levelled off or is going down in some cases. And I think this is really quite misleading because we're not really getting a decent picture of what's happening in the community, whether in care homes themselves or whether at home. And one of the things that's been happening over the last couple of weeks is that GPs are now using clinical protocols of frailty to determine which patients to send to hospital at all and which ones to leave at home, who they think might have corona. On the other hand, we've also got this very large care home population. Something like 400,000 people are in care homes. Frail, elderly people, many of them with dementia, a significant proportion of them probably within weeks or months of end of life. Now, the primary concern I have is that these seem to be being written off as though they don't really matter. And by not making them visible in terms of counting the number of deaths that are taking place, that reinforces this sense that these very elderly, frail folk are not really important. We've seen in recent days a succession of reports from individual care homes with 5, 10, even 15 deaths. One in Durham yesterday, 13 deaths in the one care home. But because these patients have not been tested for coronavirus, and because the patients who are dying at home have not been tested for coronavirus, it's highly unlikely that it will be recorded on their death certificate that they have died as a result of corona. So this is leading to a highly significant number of deaths that are not being attributed to the coronavirus. It suits the government to focus just on hospital deaths and to have us thinking about those and ignoring these other ones. Suggestions from Italy indicate that there may be 50% more deaths taking place in the community.
Jason Leach is Scotland's National Clinical Director. He's one of the most senior doctors in the Scottish Government. He explained to me why coronavirus and care homes are such a potent mix and why there is a delay in reporting.
Care homes or hospitals or children's homes or whatever, this virus likes them, and that's really, really difficult to stop. You can't shut down a country entirely. You can, of course, as you've seen now, shut the airports and shut the schools and shut non-essential businesses, but you can't shut entirely. People need care. There's a huge number of people who get care in our care homes. They have families who visit. They have all of that. It's really, really difficult to manage this type of infection. And it's particularly difficult when you, again, forgive the shorthand, when you cohort those people in one place. And that's what we do in care homes. And that's the right thing to do for compassion and care and looking after people. But when you do that with this type of infection, it's really, really challenging to stop them getting infected.
There has been some concern about the sort of the reporting in terms of the spread of the virus in these places. Obviously, we're getting daily updates on deaths after a COVID positive test in hospitals, but there is a delay in the data coming out of care homes and, as you mentioned, other institutions, deaths outside of hospital. Could you explain why that is?
So the key and most important way to get mortality statistics, traditionally, all over the world and in the UK, is death certificate data. So that's the most reliable. So, of course, we wanted to know what was happening before the death certificates, and that's what you're hearing around hospital mortality numbers. But now, both in England and Wales and in Scotland, we now have a new way of accounting for that mortality, which includes presumed deaths from COVID. Now, that's quite difficult for people to understand if they don't understand the death certificate way of working. But if somebody has these respiratory symptoms now, it's likely they've got COVID because flu has gone. We don't have flu anymore at the end of April. So medical practitioners who fill in the death certificates would write COVID on the form even without a positive test because they're making a clinical judgment that this individual has unfortunately passed away because of COVID.
What you're about to watch is a conversation I had with a carer who works in the private sector. She spoke to me on condition of anonymity for fear of losing her job, which is understandable. What she details amounts to gross negligence manslaughter. It's the story of a care home, blind to the severity of the danger posed by coronavirus, whose actions killed 10 of its residents and left many more in a life-threatening condition. Close to half of the people being cared for there.
We take it in turns to sit with the residents. We sit with them for half an hour each, and then we will rotate it so they are not on their own, because nobody should die on their own. And we talk to them, we reminisce over what we've, from when we first met them to like now, the funny things that they've done. We talk to them about their families, and we sit and we hold their hands until they take their last breath. But it doesn't end there. Once they've gone, we have to then lay them out, make them look nice, wash them, ready for when the funeral directors come and pick them up. So if the families are allowed to see them or are allowed to come in, they get to see how lovely that they act. It's absolutely awful. And we don't get time to grieve because by the time we finish with one person, we have to move on to the next. And then that person dies and then it's somebody else. And they're on their own. And the staff are doing so well. And I take my hat off to everybody I work with. But it's just so difficult. It is so difficult.
Well, I take my hat off to you. I'm so grateful for what you're doing. I mean, do you feel angry?
Yeah, I feel angry. I'm not the only one. There is a fair few members of staff where I work that feel like our managers have let us down and let the residents down. It should never have happened. It should not have got to this point. They could have done more to have stopped the spread, but also the government could have done more. They could have sent us more tests. The care homes need tests. They need to be tested. The staff need to be tested, not just whether it's a temperature or a cough, because some people aren't even getting a temperature with it. Not everyone's having all of the symptoms, but they need to give care homes tests.
It's clear people in British care homes are dying by the thousand. Residents and workers also. And as of yet, the British government is not telling you how many of them are dead, prompting Keir Starmer to ask the following question at his first PMQs as leader of the opposition.
How many social care workers have now died from coronavirus.
I don't have the precise figure for care homes. They're more difficult to establish in relation to care home workers as opposed to care home residents. But I think we can all agree in this House, every one of those is a tragedy.
I'm disappointed we don't have a number for social care workers, and I've put the First Secretary on notice that I'll ask the same question again next week, and hopefully we can have a better answer.
Eyes peeled